Today we're going to be talking about a very important issue in our state, and that's how we can help ourselves and others who may be struggling with suicidal thoughts. This training is for all State of Ohio employees and has a number of goals with it, including providing information and education about suicide, reviewing the Ohio-specific data, looking at what each of us can do, understanding signs and behaviors and identify action steps to help prevent suicide, and reviewing resources that are available for state employees, family members, our communities, our friends, and our neighbors, as each of us does have a contribution that we can make to reduce suicide. Suicide is always devastating. Each death by suicide affects countless people, including their families, their friends, their neighbors, their classmates, their co-workers, and the community as a whole. In the past 10 years, suicide deaths have increased in Ohio by about 35%. In fact, in 2016, 1,706 lives were lost in Ohio due to suicide. In Ohio and elsewhere in the country, men are much more likely to die from suicide than women. In fact, men are 4 times more likely to die of suicide compared to women. Although women attempt suicide more frequently, men are more likely to die from suicide, usually because of the means that they choose. The highest rates of suicide in our state are in men between the ages of 25 and 34 and men over age 75. So these are specific age groups that we need to be concerned about. So this gives us a little bit of background on the demographics of suicide. But what kind of things should we be looking out for? So there are a number of behavioral indications that we should watch, including increased use of alcohol and other drugs, isolation or withdrawal from normal activities, sleeping too much or sleeping too little, becoming aggressive, agitated, or having extreme fatigue, feeling hopeless or feeling trapped, feeling as if there is no other way out, and a person who has a past history of suicide attempts. If a person has had a previous suicide attempt, it is much more likely that they will have a subsequent attempt. There are also a number of health factors that are warning signs for suicide, and this includes depression itself and mood changes, chronic health conditions and chronic pain. Those individuals who have other medical illnesses are more likely to attempt suicide at some point. Having a history of trauma or abuse at any time during their life, including very early in life. Other signs and risk factors that we may see are the individual talking about being a burden, that life is no longer worth it, leaving suicide notes, or talking about ending their life, putting their affairs in order, or starting to say goodbye, or a sudden interest in guns, weapons, or stockpiling medication or other means of suicide. It's important for us to simplify all of this and really know the 5 signs of suicides, and these are from changedirection.org. And those 5 signs are a change in personality, agitation, becoming withdrawn, having poor self-care, or feeling hopeless. And if any of those are present, it's important to reach out to try to connect with a person on a human and individual basis to help inspire hope in them and to offer help. So those are the things that increase the risk of suicide. But there are also a number of things that protect people from attempting or dying from suicide. Those include possessing and developing effective coping skills in life, skills in problem solving and conflict resolution, and in nonviolent ways of handling disputes. So when life's troubles confront them, they have the ability to solve those problems. Cultural and religious beliefs that discourage suicide and support instincts for self-preservation. Actively engaging in care for themselves, including medical care and clinical care for mental disorders, physical disorders, substance use disorders, including getting counseling, treatment, medication, or support groups. Having children in the home is a protective factor, and having family and community support or a sense of connectedness in a positive kind of way. So if you have concerns about a family member, a friend, a neighbor, or a coworker who might be thinking of suicide, there are a number of things that you can do that can be helpful. The first is to be direct and talk openly with them about your concern. It's okay to ask them if they're thinking about hurting themselves or thinking about suicide. Many people feel that if I ask someone about suicide, it's going to make them more likely to attempt suicide. Exactly the opposite is true. If you ask someone about this, they often feel unburdened, and it decreases the likelihood that they're going to attempt suicide. Be willing to listen and allow them to express their feelings. Be non-judgmental. Don't debate with them about what their feelings are, their thoughts of suicide. Don't try to necessarily show them the brighter side of life, but listen and be empathetic. And then, of course, encourage them to get help. And if it's necessary, if it's an emergency situation where you're extremely concerned about imminent risk, you should call 911. What if you're feeling about harming yourself? Well, first and foremost, seeking help is important. A professional counselor, a primary care physician, a psychiatrist, any kind of helping professional should be able to provide some assistance for you. If it's an emergency situation, you should go to an emergency department to seek help. Or call the National Suicide Prevention Lifeline at 1-800-273-8255. You can utilize the crisis text line by texting 4HOPE to 741-741. You can certainly contact the Ohio EAP at 1-800-221-6327. So why is this important? Let me turn it over to the mother of a young man who died from suicide to explain to us why it is important from her perspective to address this issue throughout Ohio.
Talking about suicide prevention is important because it's generally a preventable death. Suicide is generally a preventable death. It's not always the case. Some people do everything they can to support someone they care about. But generally speaking, most people that take their lives didn't have somebody actively asking them, "Are you suicidal? How can I help you? What can we do?" They didn't have somebody in this with them. So it's important because we can all play a role. It doesn't have to just be a sibling or a parent or a spouse. It can be a friend, a coworker, a customer. It can be anyone. So if I'm interacting with somebody and the answer I get when I ask if they're having thoughts of suicide, if the answer is yes, the first thing I do is ask more questions. Tell me more. How are you feeling? How often you feeling that way? You just want to be able to be in it with them. You want to sit in it with them, ask more questions. If they are actively suicidal, as in they have said, "I know how I will do it and I'm going to do it today," you don't leave them alone. You certainly don't leave them alone. There are plenty of local as well as national resources available to us because we aren't all mental health professionals. We don't know exactly how to help somebody, and that's okay. You can find people that do know how to help them even more than you do, and that's the most important thing you can do is point them to those resources. Go with them to those resources.
Denise, thank you so much for your passion and commitment to this issue. I think that we all learned a great deal from what you had to say today. I want to thank you for your attention to this very important issue today and your willingness to reach out and help yourselves and others who may be struggling with suicidal thoughts.